Welcome back to part 2 of our venipuncture lecture for MLT 110. The very first thing you need to know how to do when performing a venipuncture is how to approach your patient. First, you need to identify yourself and identify the patient that you're performing the venipuncture on using two identifiers. And the two identifiers that we usually use for our patients are their full name and date of birth. You need to make sure that the patient's information that you have on the orders for the blood draw matches the patient information on the armband. Okay, you need to explain to the patient what the procedure is that's going to be going on as far as the blood draw. You don't have to go into a lot of detail as far as the tests that are being run. You can just say, hey, I'm so-and-so from the lab. I'm here to draw you blood based on some orders that the doctor has put in. If the patient starts to ask a lot of detailed questions about the test and why the tests are being ran, you need to refer the patient to their nurse or to their doctor to get answers for those more detailed questions. Sometimes you will come along a difficult patient that doesn't want their blood drawn or refuses for their blood to be drawn. As a lab tech or phlebotomist, you always try to encourage your patients to go ahead and get their blood drawn so the doctor will have test results in order to diagnose the patient or help treat the patient, but it is the patient's right to refuse a blood draw. So if the patient does end up refusing the blood draw, just be nice, thank them, and be on your way, and just make sure you inform the nurse or the doctor that the patient has refused the blood draw. In addition to informing the doctor or nurse that the patient has refused the blood draw, you need to document the date and time and the sample that was supposed to be collected. Another important thing to remember when you complete a blood draw is to move everything back to its original position if you moved it to complete the blood draw. For instance, if you moved bed rails or a table or anything like that, make sure you put it back in its original position where the patient can have access to it in their room. Because especially for a bed rail, if you took a bed rail down or moved a bed rail and then forgot to put it back when you finished your blood draw, you don't want to run the risk of the patient falling out of the bed had you not put the bed rail back. For the tray table, you want patients to be able to reach their drinks, their food, or the telephone. So make sure that you push everything back within arm's reach of patients when you leave the room if you've moved it to complete a blood draw. To complete a blood draw, you may have to ask a nurse or a CNA for assistance, so don't be afraid to ask for help if needed. Also, be gentle with our elderly patients because elderly patients tend to have very thin or brittle skin, and it can be easily damaged with a tourniquet or when we're performing a blood draw. Also, just the last thing is bear in mind that patients are in the hospital or in a healthcare setting usually because they're not feeling well. So if they do have an attitude with you or not so pleasant when you go in for a blood draw, just kind of keep that in the back of your mind. Just know that you're a professional, you're there to do a job. You need to be as pleasant as you can be. Try to make the experience for the patient as positive as you can, and just do your job. And always, always make sure you thank your patient when you complete the blood draw and just be on your way. Once in a while, a patient will have a reaction to a blood draw. In these cases, you just need to take care of your patient. You need to treat them accordingly depending on what's going on with your patient. If the patient is bleeding for a prolonged amount of time, you just need to hold extra pressure to help prevent excessive bruising or a hematoma. A hematoma is just another word for a bruise. If you have a patient that begins to faint or does faint during a blood draw, You need to immediately stop the blood draw by removing the tourniquet and the needle and start to care for the patient. If you can tell that the patient might be going to faint, you can try to get their mind on another subject by talking to them, or you can make sure that they're breathing. Sometimes patients will want to hold their breath, and you can make them concentrate on their breathing by telling them to breathe. Another tip that might help a person that is feeling faint or says they might faint is you can put a cold compress on the back of their neck, or you can have them put their head down between their knees to help promote blood flow. If the person actually ends up passing out or fainting, make sure that the body is supported and get the legs elevated to help with blood flow. And you can see in the image below, this person has actually passed out. So they've helped support and get this patient laid down on the floor, and they're elevating the legs and the feet in order to promote that blood flow. Another term used in the healthcare field for fainting is syncope. Sometimes it might be necessary to collect a blood sample from an unconscious patient. In this case, you would approach the patient in the same way you would a conscious patient. You would still introduce yourself, and you would talk to them to identify their identity. Now, you could talk to a family member or a nurse, or check the armband of the patient to verify the identity. Again, you would still need two identifiers to ID the patient. If you come across the scenario where a patient does not have an armband, even if the patient is conscious, you cannot complete the blood draw, especially if that patient is an inpatient. If the armband is not available, or if the patient doesn't have an armband on, you need to immediately notify the nurse for the patient in order to get a armband placed on the patient before the blood draw can be completed. In most current healthcare settings, the armbands are going to come with barcodes that correlate with the LIS systems or the computer systems of the labs or the hospitals, and the laboratory staff or the phlebotomy staff are going to have to scan those barcodes on those armbands in order to let the computer system know I have collected this blood sample for this patient. Next, we need to cover some guidelines of collection of blood from the arm, the hand, and foot veins. The veins of the arms are always the best place to complete blood draws, but they're not always an option for one reason or another. It also may be necessary to use a hand or wrist, leg, or foot vein to complete blood draws, but we usually try to avoid foot or leg veins, especially on adults. If for some reason that's the only option and you have to draw from a foot or a leg, you have to obtain permission from the doctor or nurse. For our pediatric patients or our newborns, it's a little bit more acceptable to use our foot veins, but it's always recommended to check with our pediatric units or our nursery units first before drawing from foot veins. One very important guideline to remember when performing a blood draw is to never draw blood above a running IV. And that's what this image is showing right here. You can see that this patient has an IV in their arm. And the normal place on the arm we would want to draw blood is from the vein right here in the arm. But since the IV is right here, we cannot draw above the IV. So that's why this red X is here. This would be above the IV. So if we want to draw blood from this arm, because the IV is located right here on the arm, we have to go below the IV. The reason we can't draw blood from above the IV is because that blood sample could be contaminated with IV fluid or any kind of medications that could be included in the IV fluid. Sometimes blood can be collected from the IV itself or from a central line, but this is something the nurses have to do. This is not something a lab tech can do or a phlebotomist can do. There's some areas of the body we may want to avoid on certain patients for blood draws. Any areas that have sclerosed or hard veins, or any areas that have hematomas. These are areas that may be uncomfortable for patients. Also, areas that are burned, scarred, or even tattooed are areas to avoid because these areas may have decreased circulation. The veins in these areas may be harder to feel, and also these areas may be more susceptible to infection. Now, something to note with tattoos, sometimes you do have to complete a blood draw within a tattoo just because you don't have another choice or a better area to do a blood draw in. In those scenarios, you just want to clean the area really well and complete the blood draw as normal. Okay, this next slide is on selecting a vein and completing the venipuncture. The very first thing you want to do is to wash your hands really well, or to use an alcohol-based hand sanitizer, and then you want to put on your gloves. Of course, you want to select properly fitting gloves. The next thing you want to do is place a tourniquet on your patient's arm. You want to place the tourniquet about 3 to 4 inches above the elbow, or midway between the elbow and the shoulder. And this is the correct area or placement of your tourniquet. You see the elbow here and the shoulders here, and this is about midway, or at least 3 to 4 inches above the elbow. You usually do not want to leave the tourniquet tied on the arm no more than a minute, a max of 2 minutes before loosening it. It's important that you tie the tourniquet correctly, and it's important that the tourniquet is tied snugly on the arm. When you're tying the tourniquet, you want to make sure that you're tying it in a way that one end is only tucked in, and this allows for a quick release of the tourniquet. We will be practicing on each other exactly how to tie the tourniquet, so you can practice how tight and how to get the tourniquet tied exactly right in order to have a quick release. You can ask a patient to make a fist and to hold it, then release it once the blood begins to flow into the tube during the blood draw. It's not necessary for a patient to keep pumping their hand during the blood draw. When choosing which arm to draw blood from in a patient that's had a mastectomy or a surgery to remove a breast, you're going to choose the arm opposite of the mastectomy. So we don't want to choose the arm or the side of the body that has had the mastectomy, because that side of the body is more likely to have more lymph fluid and affect the results of the test. If a patient has had a double mastectomy, meaning they've had both breasts removed, then it may be necessary to get special permission from the doctor to draw from a leg or foot vein. So we have our tourniquet tied on the arm, so we need to start actually palpating or feeling the arm to try to feel the veins of the arm. The veins should feel like an elastic tube, and there should be some pressure underneath your finger. The vein should be bouncy or springy to the touch. We want to try to avoid arteries, so when you're palpating, if you feel something pulsating or something that's got a lot of pressure, that's more likely an artery, and that's something we want to avoid because arteries have more pressure behind them. You always want to use your finger to palpate. We don't want to use our thumb to palpate because you can feel your pulse in your thumb. When you find your veins, or what you think are the veins, you want to trace the veins so you know which direction the veins are traveling in or going within the arm. If you are trying to do a blood draw in the hand veins, you need to tie the tourniquet 3 to 4 inches above the wrist in order to do a blood collection. It's best practice to examine both arms for suitable veins for a blood draw. Sometimes one vein on one arm might look a little bit better than another arm. So make sure you check out both arms before you choose the vein you're going to try to draw blood from. The more you're able to practice tying your tourniquet and the more different arms you're able to feel veins on, the more comfortable you'll be when we're actually ready to start blood draws in class. So I encourage you to take a tourniquet home from class. See if you can feel veins or palpate veins on family members and friends, and get comfortable with trying to find veins. The 3 main arm veins we're going to be trying to feel when we palpate are the 3 veins that are pictured here in this image: the cephalic vein, the median cubital vein, and then the basilic vein. Okay, let's go over the steps of performing the venipuncture. Of course, we need to clean the site, and we're going to clean this site usually with alcohol. The vein should be held steady by pulling the skin taut or anchoring the vein beneath the site. The site is where you're actually going to stick the needle in, where you're going to puncture the skin in order to hit the vein. The needle should be inserted in line with the vein. So if the vein is running at a diagonal direction, your needle should be inserted in a diagonal direction to be running along with the vein. You want to hold the needle at a 15-degree angle to allow blood flow into the needle. The bevel of the needle should always be pointed upward, and we'll see exactly what the bevel of the needle looks like in one of the next slides. But you want to hold the index finger along the hub of the needle and brace your fingers against the patient's arm in order to keep the needle steady. Especially when you're changing tubes, if you're having to collect multiple tubes within a blood draw. Another tip to help keep the needle steady is to keep your eye on the needle to make sure that it doesn't move. You want to watch the flow of the blood into the tube so you'll know when the tube is full. And you want to make sure that you're collecting the tubes in the correct order of draw. Only stick a patient twice, and if you can't complete a successful draw within 2 sticks, then ask someone else to complete the blood draw, or you could do a capillary stick. This slide is kind of illustrating some of the steps that we just talked about on the previous slide. You have your tourniquet on, you've inserted your needle into the arm, but this image is zoomed in a little bit better. You see that you're using your finger to push down and pull back on the skin. This is helping the skin be pulled taut. It's helping anchor this vein so this vein doesn't roll or move on you, so you're holding that vein into place. The needle is being inserted at the correct angle, and it's usually somewhere between 15 and 30 degrees. The needle is being inserted into the vein, and the blood is being allowed to flow into the tube. So when you're done with the blood collection, of course the needle is going to go into your sharps container, and then the blood tube itself can be inverted and mixed and go to the lab for testing. Okay, what are the steps to complete after the venipuncture is done? So the first thing you want to do is you want to remove the tourniquet before you remove the needle. If you don't remove the tourniquet before you remove the needle, then there's still going to be pressure on that vein. So when you pull the needle out, guess what's going to happen? There's more than likely blood's going to come out because there's going to be so much pressure on that vein. So always remove your tourniquet before you remove the needle. It's even recommended that if you've got good blood flow into your tubes, you can go ahead and remove your tourniquet while your last tube is being filled. Make sure that you completely remove the needle from the arm before you put any pressure with gauze to stop blood flow. You can even ask your patients to help hold the gauze if you need to. Also, immediately engage your needle's safety when you pull it from the arm, and you want to engage the safety of the needle using a hard surface. Remember to invert your tubes, your blood tubes after collection. This will allow them to mix with any of the additives or anticoagulants within the tube. Remember, we want to use gauze versus a cotton ball when we're trying to stop bleeding after a venipuncture, because the cotton fibers can dislodge a platelet plug. Patients that are on blood thinners or anticoagulants, again, they can need a little bit longer for pressure to be held on the puncture site, because the blood takes longer to clot for those patients. It might be a good idea to use a pressure bandage like Coban on a patient that you're having a little bit more trouble with them to stop bleeding. Make sure that you always label your tubes after collection and before leaving the patient's room. This is very important in preventing samples from getting mixed up or from them getting labeled incorrectly. You always want to verify that the information is correct and that you've collected the correct tube for the test. The last thing you want to do before you leave the patient's room is to thank the patient and thank them for allowing you to complete the blood draw, and to put everything back in order in the patient's room. If you moved anything to complete the blood draw, make sure you put it back in its original position. Okay, so let's talk about the different parts of the needle. Let's first talk about the bevel. We mentioned the bevel a little bit earlier, but we didn't actually see what the bevel looked like. We just mentioned that it should be facing upright when you're completing a venipuncture. So let's look at this image of a needle. So here's the needle, and at the very end you see this sharp angled opening. This is the actual bevel of the needle, and again, it should always be facing upright. The safety of the needle is going to be attached to the needle, and this allows for the needle to be quickly covered or safetied after completion of a blood draw. The tube holder attaches to the needle, and it helps hold the tubes during the blood draw, and we'll see a little bit later on what this looks like. The bore is the center or the middle opening of the needle, and the needle can have different sizes of the bore. We call the internal diameter or the size of the bore of the needle the gauge. The bigger the gauge of the needle, the smaller the needle. And then the smaller the gauge of the needle, the bigger the needle is. I know this can be a little bit confusing, but if you look at the image for comparison, we're going to start over here at the 18 gauge needle. This is a smaller gauge, but if you look at the size of the needle itself, the actual bore or the diameter of the needle is larger when you compare it to the 30 gauge needle. The 30 gauge is larger in number, but the needle itself, the diameter or the bore, is smaller. The most common size or gauge of needle used for phlebotomy is about 21 gauge. The larger the needle size or gauge, it can help preserve red blood cells. The most common size or gauge for butterflies is about 22 or 23. The smaller the gauge of needles may cause damage or hemolysis of the red blood cells. Hemolysis means the red blood cells have burst. Sometimes healthcare facilities want to limit the number of butterflies they use because butterflies are expensive. But sometimes butterflies are necessary when you're collecting samples from fragile veins, like veins of children and elderly patients. So this image is showing you some of those parts of the needle that we just discussed on the previous slide. You have the needle and you have the bevel of the needle at the tip. The middle part of the needle is known as the shaft, and then you have the hub of the needle, and then here is the holder, or the tube holder. This is where the blood tubes are going to be inserted in, and there's actually a needle on this side of the hub as well. This is the needle that's going to insert into the tube. This is the needle that's going to go into the arm or the vein, and this needle that is covered up by a rubber sleeve is going to be inserted into the tube so the blood can flow into the tube. So there is a rubber stopper that is in the top of the tubes, and then this tube is known as a vacuum container because there's actual vacuum pressure in these tubes that allows the blood to be drawn into these tubes. And just one other thing to mention about these holders, these tube holders, they have a little rim on the back end of it that's known as the flange. This flange is there to help you take tubes on and off of the holder. This image is here to mainly show you the safety that is included with your needles. The top needle is showing you with all the caps and safety included on the needle, and this image below is showing you the needle with the two caps taken off. So within this green cap is the side. This is a double-sided needle, so this is the side of the needle with the green cap. This is covering up the needle, or the part of the needle that's going to go in the arm and in the vein. And the clear cap is covering up the side of the needle that's going to go into the tube holder, and this part of the needle is also or it also has that rubber sleeve on it. So if we jump down here, this is the exact same needle, we just have removed the two caps. So again, this is the double-sided needle. So we've removed this green cap, so we have exposed the needle. So this is the bevel right here. This is the end that's going to go into the arm. This is the end that's going to go into the tube holder, or sometimes we just refer to it as the hub. And again, you can see that rubber sleeve that's on this side of the needle, and ultimately the blood tube is going to come up and be inserted onto that tube, or onto that needle on this side. The last thing of note on these images are the safeties themselves. These purple structures kind of hanging off the edge of the needles are the safeties. The safeties are immediately activated after the venipunctures are completed. So let's say you pull the needle out of the arm, and then you're immediately going to push the safety up on the needle so the needle is no longer exposed. And we're going to use a hard surface to activate these safeties. And the purpose of these safeties is to prevent a stick or an accidental stick by these needles. On this image, I want to show you what a butterfly looks like. It's called a butterfly because it has these little tabs that kind of look like butterfly wings. Remember, your butterflies are usually smaller gauge needles. They have a smaller diameter, a smaller bore usually. They have this tube that's attached to them that allows you to have a little bit more maneuverability with a butterfly. Some people prefer using a butterfly over a straight needle, but again, some healthcare facilities limit the use of butterflies because of cost. This concludes part 2 of our venipuncture lecture. I hope you have learned a lot in this portion of our lecture. I was hoping to conclude our venipuncture lecture with 2 parts, but it looks like we're going to end up with 3 parts. So I will see you over in part 3.